The number of acute stroke patients seeking emergency care has declined globally. Neurologists say this may be due to patients fearing COVID-19 exposure in hospital emergency rooms. Now, people suffering stroke symptoms must visit the emergency room. Neurologists also warn of an increase in reports of COVID-19 related strokes. Dr. Stacey Rousseau joins me now on Skype from East London. Dr. Rousseau, very good morning. In layman's terms, just please explain to us when the term that we're using here, acute strokes. Explain that to us.
Hi, and good morning to your viewers. So an acute stroke is when you present with a typical stroke symptom, so facial asymmetry or drooping, slurred speech. But the most important thing is the patients should get to their nearest stroke hospital within a specific time limit, 4.5 hours, so that we can give them thrombolytic therapy. So layman's term, an intravenous drug that will be able to dissolve the clot intracranially that typically causes the stroke. So hence why we encourage patients with these symptoms to present as soon as possible to their nearest stroke-ready hospital to get this treatment.
Yeah. Now, worldwide, a lot of patients are not going in, especially when they start displaying those symptoms, and most fear their biggest fear is risk of exposure to COVID-19 if they should walk into an emergency room. Is that fear real?
So yes and no, because we within the stroke fraternity have made provision that within all stroke-ready hospitals, while within any hospital, care pathways have been amended to mitigate the risk to both the patient and to the staff treating them. So we would still advise all patients, especially those with acute stroke patients, to present to the hospitals as, like I said, pathways have been amended to make sure that they remain safe and that the patient and that the staff will remain safe. Acute stroke still remains an emergency, and providing evidence-based care to them will reduce mortality and improve their functional outcome.
Now, we know at the present moment doctors are still learning and scientists are still learning a bit more about COVID-19, but worldwide there are reports of COVID-19 related strokes in the middle-aged group in terms of populations. What do we know about that?
Yeah, so it does seem that looking at the evidence, and like you said, we are learning as we go along, that there seems to be an increase or an increase in stroke incidence sort of in your 30 to 50 year age group. And yeah, that is concerning. With regards to the mechanism of injury, like I said, we're still learning. We do find that often these patients that do present with COVID are known to have vascular risk factors. And we know that, like your hypertension, your diabetes, obesity, and high cholesterol, it is exactly in that same age group that patients would also develop with strokes. So we suspect that coupled with those risk factors, we do see an increase in the stroke incidence, and therefore patients will be screened for COVID symptoms. Yep. And again, we encourage them to present themselves to their nearest stroke-ready hospital as soon as their stroke symptoms occur.
Doc, if I may ask you, I'm not sure whether this is in your field or not, but we're also seeing an increase in blood clotting when it comes to kids because of COVID-19. Can you tell us about that?
So yeah, so I'm an adult neurologist, but the principles remain the same. We see that with COVID, there's this inflammatory response within the body, and that in itself either causes damage to the blood vessel itself and or causes essentially your blood products to become sticky. So we don't just see an increase in stroke, but we've also seen an increase in other cardiovascular injury, specifically heart attacks and heart injury, and it seems like that is also the mechanism for the pneumonias that we see. So as the evidence are evolving, we're literally learning day by day, from this pandemic. Yeah.
Very true. So, Doc, your final word: when you get any of the symptoms of a stroke, do not hesitate. Go straight to an emergency room.
So yeah, we cannot emphasize that, anymore. So symptoms, facial drooping, slurred speech, immediately, as soon as you can, get to your nearest facility. Acute strokes can still be treated. By treating them reduces morbidity and mortality. So yes, we would encourage our patients to continue on to their nearest hospital as soon as they can.
100%. Thank you so much for speaking with us, Dr. Stacey Rousseau from East London there, joining me via Skype, talking about the number of acute stroke patients who are seeking medical care. That number has gone down when it comes to them going to the hospitals and so forth. But she's saying, go to the hospital. You need to go to the hospital.